Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, May 11th, giving you the update from Albany Med. All right, Fred, let's pop open the first graph here. Capital region, 8 counties, people in the hospital currently with COVID. This is a number that's lower than we've seen in quite some time. We're now down to 71.
Yes.
71. So moving in the right direction. And we don't have this graph. Maybe we'll show it Thursday. But if you look at the statewide graph, that's coming down even quicker.
It absolutely is.
Yeah.
It absolutely is. And nationally, we're below 40,000 new cases for the first time on a daily basis since September.
All great news.
Yes.
Let's look at the graph. Admissions and discharges here at the medical center. Fred, just like we showed last week, about 1 to 2 admissions per day.
Yes.
If you look out over the last 7 days, the delta is we've come down by about 6 or 7.
That's right.
But if people are paying attention on that graph, they see a little orange or little yellow area there a couple days ago, and that would represent our second flu case of the season.
Someone transferred from us from down south in the Hudson Valley.
Yeah, so been a remarkable flu season for the lack of it. Flu B, only the second case this year.
Yes.
Next graph, the morning census here at the medical center. So this actually can be updated, but by the time this was published, 18 in the hospital, 12 on the floor, 6 in the ICU, Fred, 2 on ventilators, all adults, no children.
That's right.
And actually since then, I think that number, I just looked at it before I came over here, actually was 15.
Right.
So maybe a couple discharges and no admissions yet today.
That's right.
So that's all great news.
So we're moving in the right direction.
No question about it. Also moving in the right direction, vaccine numbers. Let me just give a quick overview there. Same area, capital region. If you look at people, Fred, that have received at least 1 shot of a vaccine, which as we've said sometimes is all they need if it's the Johnson & Johnson, 587,000. Okay, so that's 54.1% of the total population. But if you look at those 18 and above, 65.7%. So we are really moving along there.
That's tremendous.
Yeah. So Fred, we know obviously that the age group dropped down to 16, and now the question is 12 to 15, and there may be an update.
That's right, Dennis. So Pfizer did a study in 12 to 15-year-olds. About 2,200 kids, half received the vaccine, half received placebo, and none of the children who received the vaccine actually contracted COVID. So 100% effective in preventing symptomatic COVID. So that's been looked at by the FDA, and we heard, I think late on Friday, that the FDA was going to grant approval. There is one more step, and it's going to go to the CDC panel tomorrow. At 11:30.
Okay.
And the expectation is the panel will approve it, and then it will become immediately available.
We know that in this region, we're prepared as early as Thursday when that approval comes to begin to administer it to 12 to 15. But Fred, I'm so glad you talked about the study because some people have come up to me that I know and say, oh, I understand they're going to vaccinate 12 to 15-year-olds. Did they just extrapolate that off of the adult study? And I said, no. It had its own separate study and its own safety profile.
That's right.
And when they do it for presumably 2 to 11, same thing. Its own separate study.
So the 2 to 11 study is going on right now.
Okay. Very good. Very good. Fred, a question came in, so we'll give you an opportunity to answer it. If you have a child who has asthma, is it safe for them to get the vaccine?
So Dennis, there's no contraindication for asthma with the vaccine.
Okay.
And as a matter of fact, we know that people, both children and adults with asthma, are at higher risk with COVID for more symptoms, worse symptoms. So absolutely, a child with asthma should get vaccinated.
All right, good. Thank you for clarifying that. There's no question then. Fred, let's change topics a little bit. As we mentioned last week, we kicked off Nurses Week.
That's right.
It ends this week on the Florence Nightingale's birthday.
She would have been 201 tomorrow.
Okay. Happy birthday to Florence, if she's listening. So we talked about, and there's been a series of events really all week. And today, we'd like to speak about 2 nurses in particular who have been recognized. Times Union does this every year. Salute to nurses.
That's right.
And every year we're so proud. We always have at least a couple nurses who are recognized as the best in the capital region.
That's right.
So I'll name the first one. So Marlene Austin, who works in pediatric endocrinology. For those that don't know, that might be treating, for example, diabetes. So Marlene Austin is a registered nurse, recognized, Times Union, best nurse in the region, one of the best nurses in the region.
That's tremendous. And Cheryl Clow, who is in genetics.
Yep.
So working in that area, again, recognized as one of the best nurses
Yep.
in the region. Been with us a long time.
Yes.
Really tremendous people, both of them.
If my memory serves correctly, she was once Employee of the Year here.
I think she was,
Yeah,
Dennis.
yeah.
I think
We
she
all
was.
know Cheryl as well. So
Congratulations to both of them.
both of them. And we look forward to the events through the rest of the week, including the recognition of the 2021 Pillars of Nursing at Albany Medical Center.
That'll be tomorrow.
Tomorrow. So speaking of pillars, they're lit up blue. The first reason dovetails into what we were just talking about. We lit it up as blue in recognition of our great nursing workforce here at Albany Medical Center. And there's a second reason why they're lit up blue.
Well, Dennis, this is actually National Hospital Week as well, as designated by the American Hospital Association. And, it has particular meaning this year,
Oh, yeah.
We've come through, a really very difficult time with COVID. And, it's important to acknowledge that. People who work in hospitals have done just a tremendous job in caring for their communities at the medical center as well as all hospitals around the country. So this is in recognition of that effort that all hospitals have put out and their employees for patients in their communities.
And everybody knows this, of course, because we say it every day in the video. Dr. Venditti is the hospital director. He runs the hospital. The hospital this year that was recognized by the Times Union Readers Poll as the best hospital in the Capital Region. So again, congratulations to you and Fred and the entire hospital team. And we recognize all of them by lighting up the pillars blue. And one of the really important missions, one of the very important service lines that we deliver here in the hospital is stroke care. Fred, and it's an important month for stroke.
Right, so May is Stroke Recognition Month. So we talk about something called Be Fast.
Be fast.
Balance, eyes, face, arms, speech, and time. So those are the areas that can be affected by stroke. So
Right.
weakness in your arm as an example. Time is in there because time is of the essence. If you develop one of those symptoms, seek medical care.
Stroke care is one of those things when I think about the medical center that is unique in the region as far as the degree and the complexity of what we do. It starts pre-hospital, comes into the emergency department, it spreads to the operating rooms, procedure areas, critical care. It includes doctors, nurses, physical therapists, a whole host of individuals, many of whom I probably haven't mentioned, the lab, et cetera. And we provide comprehensive care that a lot of other hospitals in the region cannot do.
We're the only comprehensive stroke center in the region as designated by the Joint Commission.
Right.
So we do lots of things, everything you mentioned, including things like mechanical blood clot removal from arteries in the brain to relieve the problems that causes ischemia.
And we've seen those videos, Fred, where people will come in and they'll have a deficit.
Yes.
They can't move an arm, they can't speak, and then when the procedure is done, everything is moving and they're speaking normally again. It's really incredible to see.
Very remarkable.
So to our entire stroke program, all of you who serve in that role, everybody, we congratulate you.
Yes, thank you.
So that'll be it, Fred. We'll be back again on Thursday.
Yes.
And there's no shortage of the things that we can recognize and sort of speak about here. So I'm sure we'll have some other things to talk about on Thursday.
Definitely.
All right. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.